Metoclopramide is an antiemetic agent and dopamine D2 antagonist used in the treatment of gastroesophageal reflux disease, prevention of nausea and vomiting, and to stimulate gastric emptying. In this video, let's found. What is metoclopramide? What is metoclopramide used for? Contraindication. What are the side effects of taking metoclopramide? How does metoclopramide work? How to use metoclopramide? What is metoclopramide? Metoclopramide is a medication used for stomach and esophageal problems. It is commonly used to treat and prevent nausea and vomiting, to help with emptying of the stomach in people with delayed stomach emptying, and to help with gastroesophageal reflux disease. It is also used to treat migraines. In 2012, metoclopramide was one of the top 100 most prescribed medications in the United States. It is available as a generic medication. It is on the World Health Organization's list of essential medicines. In 2020, it was the 352nd most commonly prescribed medication in the United States, with more than 600,000 prescriptions. What is metoclopramide used for? Metoclopramide in the oral tablet form is used for symptomatic treatment of both acute and recurrent diabetic gastroparesis, in addition to the treatment of gastroesophageal reflux disease, GERD, in patients who have failed to respond to traditional therapy. A nasal spray formulation is also indicated to treat adults with acute, recurrent diabetic gastroparesis. In the intravenous injection form, it is indicated for the above conditions as well as for the prevention of vomiting that may follow a metagenic chemotherapy or nausea and vomiting after surgery. Contraindication. Metoclopramide is contraindicated in pheochromocytoma. It should be used with caution in Parkinson's disease since, as a dopamine antagonist, it may worsen symptoms. Long-term use should be avoided in people with clinical depression, as it may worsen one's mental state. It is contraindicated for people with a suspected bowel obstruction, in epilepsy, if a stomach operation has been performed in the previous 3 or 4 days, perforation or blockage of the stomach, and in newborn babies. Contraindication. Metoclopramide is contraindicated in pheochromocytoma. It should be used with caution in Parkinson's disease since, as a dopamine antagonist, it may worsen symptoms. Long-term use should be avoided in people with clinical depression, as it may worsen one's mental state. It is contraindicated for people with a suspected bowel obstruction, in epilepsy, if a stomach operation has been performed in the previous 3 or 4 days, perforation or blockage of the stomach, and in newborn babies. Side effects. Common adverse drug reactions, ADRs, associated with metoclopramide therapy include restlessness, akathisia, and focal dystonia. Infrequent ADRs include hypertension, hypotension, hyperprolactinemia leading to galactorrhea, headache, and extrapyramidal effects such as oculogeric crisis. Pharmacodynamic. Metoclopramide increases gastric emptying by decreasing lower esophageal sphincter, LES, pressure. It also exerts effects on the area postrema of the brain, preventing and relieving the symptoms of nausea and vomiting. In addition, this drug increases gastrointestinal motility without increasing biliary, gastric, or pancreatic secretions. Because of its antidopaminergic activity, metoclopramide can cause symptoms of tardive dyskinesia, TD, dystonia, and akathisia, and should therefore not be administered for longer than 12 weeks. Mechanism of action. Metoclopramide causes antiemetic effects by inhibiting dopamine D2 and serotonin 5-HT3 receptors in the chemoreceptor trigger zone, CTZ, located in the area postrema of the brain. Administration of this drug leads to prokinetic effects via inhibitory act on presynaptic and postsynaptic D2 receptors, agonism of serotonin 5-HT4 receptors, and antagonism of muscarinic receptor inhibition. This action enhances the release of acetylcholine, causing increased lower esophageal sphincter, LES, and gastric tone, accelerating gastric emptying transit through the gut. Metoclopramide antagonizes the dopamine D2 receptors. Dopamine exerts a relaxant effect on the gastrointestinal tract through binding to muscular D2 receptors. Half-life. The mean elimination half-life of metoclopramide in people with healthy renal function ranges from 5 to 6 hours, but is prolonged in patients with renal impairment. Downward dose adjustment should be considered. Dose. Chemotherapy-induced nausea and vomiting. 2 mg per kilogram 4, infused over at least 15 minutes, 30 minutes before chemotherapy, then repeated 2 more times Q2HR, after initial dose. Vomiting suppressed, decreased to 1 mg per kilogram Q3HR for 3 doses. Vomiting not suppressed, continue same dose Q3HR for 3 doses. Diabetic gastroparesis. 10 mg 4/IM/PO Q6HR 30 minutes before meals and at bedtime, use injectable dosing if severe symptoms are present. Small bowel intubation/radiologic examination of upper GI tract. 10 mg 4/1 to 2 minutes. Gastroesophageal reflux disease. 10 to 15 mg PO Q6HR 30 minutes before meals and at bedtime, not to exceed 80 mg per day. Postoperative nausea and vomiting, off-label. 10 to 20 mg IM administered near end of procedure, may be repeated postoperatively Q4-6HR PRN. Safety advice. Metoclopramide is classified as pregnancy category A and is the most commonly prescribed antiemetic in pregnancy. Category A may appear reassuring in terms of safety, but does not give any indication of the drug's efficacy.